In this video, we will explore burnouts among home healthcare providers using qualitative research done at the Restore Lab. Hi, my name is Idris, and this is part 2 of a two-part series on burnouts research at the Restore Lab. So if you haven't already, check out part 1 to learn more about what burnout is and how to manage it. If you're watching this from Canada, you've probably seen headlines on burnouts among doctors and nurses during the pandemic. There has been a lot of coverage on this group of workers. But what about rehabilitation and home healthcare providers, occupational therapy, physiotherapy, speech-language pathology, and other professions? Home care rehabilitation professionals are an underreported group in the media. They are also an under-researched group. This leads us to a qualitative study on the home care rehabilitation professionals undertaken by the Restore Lab, published in the year 2024. Rehabilitation is focused on promoting independent living and improving quality of life. Rehabilitation professionals that provide home care include occupational therapy, physiotherapists, speech-language pathologists, dietitians, and social workers. The patients and the conditions they support can vary. Rehabilitation is not limited to just individuals with physical disabilities or elderly individuals. They can also include school-aged children who experienced a traumatic car accident, for example, who require support from a team of rehab professionals to relearn how to walk. So to conclude, home care rehabilitation professionals can support any age group with any medical condition. The purpose of this qualitative study was to investigate the connections between the COVID-19 pandemic, occupational stress, and occupational burnout among home care rehabilitation professionals in Canada. This can support the development of recommendations to support this group of workers during future public health crises. And all three factors are conceptually related to one another, as you will see later on. In this study, 24 home care rehabilitation professionals, also known as HCRPs, were interviewed. Questions were asked about their work experiences during the COVID-19 pandemic and the impact on their mental health, particularly their experiences with job stress and occupational burnouts. These are a list of questions that captured information about occupational stress and burnout during the pandemic. Topics include emotional exhaustion and depersonalization, tasks of everyday life, and career changes. Some of these questions include, tell me about what it was like to work during the pandemic. Tell me about your preferred area of work, and what are some of the stressors you experienced at work? There were three main themes found from the study: unique challenges in the profession, COVID-19's impact on stress and burnout, and coping strategies. Working in home care can be challenging compared to hospitals or offices. In home care, providers mentioned their experience of work stress and fatigue from planning their daily commutes and preparing to visit clients' homes. They also take additional time to travel and collect office supplies for home visits. HCRPs also emphasize the difficulties of encountering unpredictable and sometimes unsafe care environments when visiting a client's home. For example, there may be bed bugs or general unsanitary conditions in the patient's home, posing a health risk to the provider. Medically complex patients, dealing with the caregiver of the client, and feeling disrespected due to power imbalance were also reported by HCRPs. So starting with the reduced workplace environment and reduced healthcare resources subtheme, because of COVID-19, HCRPs had a hard time adapting to the new health and safety guidelines. But one reason for this was the mandating of additional paperwork and screening protocols. There were also PPE shortages and continuous sanitization of equipment required, further contributing to the burden in managing care. Fear of contracting and transmitting disease to clients was also reported. Some HCRPs reported that the PPE itself would cause anxiety due to difficulty breathing or their face shields fogging up when performing their clinical duties. Other limited healthcare resources include a limited ability to secure trial equipment and difficulty in accessing community and social services for their clients due to closures or suspensions of most community programs during the pandemic. Next, a lack of collaboration and socialization was identified as a challenge. Due to the COVID lockdowns, there is a shift from in-person to online rehabilitation practice and meetings. This created a loss of regular engagement and interaction between colleagues. Further, feeling unable to meet pre-pandemic referral demands was another major source of stress and burnout. Finally, availability and timeliness of workplace support was important to this population. Some participants felt that the organization did not support them enough with managing the administrative burden of the influx of referrals. Others reported that the COVID pandemic itself made it difficult to interact with colleagues. A breakdown of the team dynamics was reported because they didn't collaborate or interact with their colleagues as was done prior to the pandemic. There was a total lack of regular team meetings and meetups, impacting the ability for colleagues to meet and provide mutual support to one another. Now, moving on to the theme of coping strategies, some professionals reported that they sought out employee assistance resources for their mental health or consulted with a private therapist. Others noted difficulty in accessing employee assistance resources for their mental health, and more can be done by the organizations to promote these resources. Next, feelings of professional value is a major concern. Many in the profession enjoy making a difference in others' lives. This was noted as an important factor because it motivates them to continue to persevere despite the difficulties of the profession. Personal adaptability to stress was also important, and this was found to vary between professions and contexts. Finally, the availability and timeliness of therapeutic and social supports from work is very important to home care rehabilitation professionals. The next sections will highlight impactful quotes from each theme. One quote that stood out was the following: "Going into client's home, it's kind of challenging sometimes too. There's that power dynamic when you are going into the client's home, but you are providing a service. They almost feel like they can be disrespectful towards you." There were also quotes on bed bugs and hazardous conditions in client's home, further implicating the challenge of working as a HCRP. Regarding COVID-19, one participant states, "I think I felt more isolated from my colleagues and more isolated from other services that I partner with." This relates to the loss of collaboration and social supports during the COVID-19 pandemic. One participant shared, "I have stayed because I really feel like that sense of efficacy that I'm making a difference. I love that I can see I have that relationship with those clients." To conclude, 3 recommendations arose from the study. First, provide opportunities for peer-to-peer socialization and mutual support. Next, promote community resilience. An adapted group version of mindfulness-based cognitive behavioral therapy have improved feelings of anxiety, stress, and depression in healthcare workers. Authors recommend adopting the same intervention for home care rehabilitation professionals. Finally, recognition and appreciation for work well done is important. This has shown to prevent burnout and support well-being. Making employees feel appreciated using incentives can reinforce their good work done and make them feel better about themselves and their work.